My name's Allie. I'm a nurse at Spring Fertility, and I'm going to be reviewing with you all your medications and the administration process. All the medications are working to stimulate the growth and maturation of your follicles and the egg within inside that follicle. The overall goal of the stimulation is to get as many follicles to grow and mature at the same rate so that you get the most number of mature eggs in the end. You'll be taking about 2 to 3 medications each day for 8 to 12 days, depending on your body's response. Throughout that time, you'll be coming in for monitoring appointments. These appointments last about 15 to 20 minutes and will involve an ultrasound where we'll be measuring the size of your follicles, and a blood draw that will involve checking an estrogen level that should continue to rise throughout the stimulation process. In the end, when your follicles are at the ideal size where your doctor thinks you'll get the most number of mature eggs, you'll meet with a nurse to review the instructions for Trigger. The Trigger medications typically are 2 medications that are taken at a very specific time, and your retrieval will occur 34 to 36 hours later. This is all a generalized review of the medications. Everyone's treatment protocol is different and specified for you to make sure you have the best outcome. There are other protocols that were not covered in detail and may be a little bit different. Email is the primary form of communication between you and the nurse. That means that you should be regularly checking your emails prior to the start of your stimulation and throughout your cycle. Most emails will be sent to follow up after each monitoring appointment between 12 and 5 p.m. If you are expecting an email, please be sure to check your junk or spam folder. The stress of starting these injections and needle phobias are real. If this is very overwhelming to you and you would prefer to pay for someone to come to your home to do the injections, there are services available to you. Now I want to review with you logistics. First of all, when you receive your big box of medications, make sure to open it up and go through it. Make sure that you have all the medications that you'll need for your protocol and all the required supplies, including syringes, needles, alcohol swabs, and a sharps container. If you feel like anything is missing or you're not sure, always reach out to your patient coordinator. For timing of the medications, it's important that they're taken within a 3 to 4 hour window. Therefore, if you have plans one night, you can always decide to take it a little later or a little bit earlier, but you want to keep it relatively consistent. We recommend setting an alarm to make sure that you don't miss your injection time. Another important part is refills. If you are self-pay or using our medication package, this means that you've only ordered a small amount of medications for you, closer to about 8 or 9 days worth. This means that you'll frequently need to be refilling medications. Always keep track of how much you have. If you only have 1 to 2 nights left, reach out to your nurse to see if any more needs to be ordered. Now I want to review with you the potential side effects. The most common side effects are bloating, cramping, and fatigue. These are likely to increase throughout the stimulation as your hormone levels will rise. Feel free to take any ibuprofen or Tylenol to help with the pain management of the cramps. Another common side effect is weight gain. You're expected to gain about 3 to 5 pounds throughout your stimulation. This has to do with water weight gain related to your high hormone levels. This means that once your hormone levels return to normal, typically about a week following the retrieval, you should return back to your normal weight. It's very common for patients to experience some heightened emotions and sensitivity throughout this process. It has to do with your hormones as well as the stressful process on top of your already stressful lives. Now let's talk about lifestyle modifications throughout your stimulation process. This is a good time to slow things down and take it easy and indulge in some self-care. Throughout the process, you can eat a balanced diet and drink alcohol and caffeine within moderation. If having intercourse with a male partner, please be sure to use condoms throughout the stimulation and prior to. This really should start from the period before you start the IVF process. Throughout the stimulation process, your ovaries are going to be very enlarged. We therefore will need you to decrease your exercise activity level and avoid high-impact exercises. It's okay to continue light jogging and stationary biking, as well as yoga and Pilates. Be sure to avoid any intense twisting or inversions. Throughout stimulation, it's okay to be using heating pads on your abdomen and going into hot tubs. Once you've had an embryo transfer and there's a chance that you could be pregnant, we ask that you stop these activities. We need you to be local throughout the time of your stimulation. This is because you'll be coming in for the frequent monitoring appointments to ensure that you're getting the best outcome possible. We will work around small weekend trips if it works out with your schedule. However, if it's during your estimated retrieval time, it's likely that you will need to cancel these plans. This is about a 2-week time frame where you'll need to be local for stimulation. Acupuncture is a great adjunct therapy throughout your stimulation process. However, if completing any herbs or herbal remedies in your treatments, we ask that you stop once the stimulation medications have started. Most multivitamins are okay to continue throughout your stimulation. However, if anything is related to your hormones or fertility medications, please check with your nurse to make sure they are okay to continue. If you are planning to conceive in the near future, please be sure to be taking a prenatal vitamin that contains folic acid. Now we're going to review all of the medications that you may have. If you received your box, you know how overwhelming all of it can be. The first 2 medications are the follicular stimulating hormone. They come in 2 forms, either Gonal F or Follistim. Whichever you have is dependent on your pharmacy and your insurance coverage. You will only need one or the other, and they can be used interchangeably. Both medications need to be refrigerated, and they're taken in the evenings, typically started at your baseline, and to be continued throughout the 8 to 12 day process. The next medication is Menopur. This has 2 hormones, FSH, the follicular stimulating hormone, and LH, the luteinizing hormone. Both these hormones work to help stimulate the follicles to grow. This medication will involve mixing and is also going to be taken in the evenings. It does not need to be refrigerated. The next 2 medications are Ganerelix and Cetrotide. These are both GnRH antagonists. These medications stop your body from naturally ovulating. They're typically not started until about 6 to 8 days after taking the FSH and Menopur. These medications are also dependent on your insurance and your coverage and therefore can be used interchangeably, but you will only need one. The next 2 are your trigger injections. They are Lupron or leuprolide acetate and HCG, which is human chorionic gonadotropin, which comes in varying forms, Pregnil or Novaril. Your trigger instructions will be reviewed with you by a nurse when you come time. Lupron comes in 2 forms, either a 2-week kit, which can be kept at room temperature until opened and then should be refrigerated, or a compounded trigger that should be refrigerated upon when you receive it. The HCG is a powder that will require mixing. Your dose will be very specific to you and can be kept at room temperature until once mixed, and then it must be refrigerated. All of the injections will be given in the stomach region. To select your site, you want to be a minimum of 2 finger widths away from the belly button, but more like 4 is most comfortable. You can select a site to the right, left, or below the belly button region. You want to avoid any scar tissues. Each night, you want to change your injection site. Since you're doing 2 injections, you can do one next to the other, or one on one side and one on the other, whichever your preference. A frequent concern when preparing for your injection is air bubbles in your syringe. It is always safe to inject an air bubble as we're only going into fatty tissues. However, if you notice that there's a large air bubble in your syringe, you just gently tap on the syringe until all the air collects at the top of the needle. You'll then push on the plunger until it fills with fluid. Now let's review Menopur. The most common starting dose of Menopur is 150 units. Each vial of Menopur powder is 75 units. Therefore, in order to get 150, you will need to take out 2 powder vials and 1 liquid vial. You will always only need 1 liquid vial. Therefore, if you decrease to a lower dose of 75, you'll need 1 powder vial and 1 liquid vial. The other supplies you will need for this injection is a 3 cc syringe, a Q cap, which comes in the box with Menopur, and a small injection needle. That's a 27 gauge half-inch needle. First, we'll open up our 3 cc syringe and the Q cap. You'll then want to take the tops off all 3 vials. You'll then take the Q cap, puncture onto the liquid vial, and remove the plastic top. You'll then take the syringe and twist onto the Q-cap, just until tight. Turn the vial upside down so it's facing towards the ceiling and draw down to the 1. Just like so. The top black line should be at the 1. You'll notice that there's a lot of pressure in the vial that's pulling back on the syringe. In order to hold it steady at the 1, keep your thumb at the base of the syringe. You'll then remove the liquid vial from the Q-cap. You'll then puncture into your first powder vial. Push all of the fluid in. The powder should dissolve instantly, but gently swirl until fully clear. You'll then turn upside down and draw up all of the liquid. The powder adds no volume, and therefore it should be back at the 1. You will then remove the powder vial from the Q-cap. You'll repeat this process into your next powder vial. Puncture on with the Q-cap, push all of the fluid in, gently swirl to dissolve, make sure that it's clear. You'll turn it upside down and draw it all back up. Remove the vial from the Q-cap. Now your medication has been fully diluted. You have 1 cc of fluid with 150 units of the Menopur. You'll twist off the Q-cap. Now time for the injection needle. You'll open the injection needle and twist onto the syringe. Pull off the cap and you're ready for the injection. Choose your injection site, go straight in with the needle, push down on the plunger, pull out, and dispose of in your sharps container. Now let's review the second version of FSH, Gonal F. This pen is already pre-filled. You'll need to remove the cap and attach a needle. Peel off the paper top of the needle and twist on to the top of the pen, just until tight. Then remove the large needle cap and hold on to this. Remove the smaller needle cap and set this aside. You will now dial to your dose in this window. You'll use the white knob to turn to your dose. 225 is a common dose. We'll dial to that. Then the medication is ready to administer. To inject, you'll select your injection site, go straight in with the needle, and push down on the plunger. Pull out the needle and make sure that it reads 0. This means you administered your full dose. Please note that you'll need to apply steady pressure when pushing down on the plunger. A gentle tap to the white knob will not administer your medication. With this pen, you can dial to your dose up and down without worrying that any medication will come out. An important thing to note with your Gonal F pen, there is always an extra 100 units of medication. In order to utilize this amount of medication and save you the money, you will need to dial to your dose, administer the injection. Once the medication has run out, the plunger will stop. You'll then need to look at the number remaining in the screen and write this number down. You'll then need to get a new Gonal F pen, dial to that dose, and administer a second injection. This requires 2 injections to get your full dose, but allows you to utilize all of the pen and save you the money. After your second injection, you'll need to remove the needle, replace the cap, and put back in the refrigerator for the next night's dose. Follistim comes in 2 portions, the pen and the cartridge. The cartridge should be kept in your refrigerator. First, you'll want to get the cartridge and open. Then you'll want to take out your pen injector. The pen injector comes apart into 3 pieces. First, remove the cap. Then twist the body of the pen into 2 pieces. You'll want to hold on to the yellow portion and insert the cartridge. The silver tip of the cartridge should go to the bottom of the yellow portion. You'll then twist your pen back together. until tight. Now you'll need to take a needle cap and remove the paper. The needle will get twisted to the top of the pen until tight. Then remove the large cap and hold on to this. Take off the small cap and throw that one aside. You'll then need to dial to your dose. Most common dose is 225. You'll want the 225 dot to reach the IU marker. You're now ready to inject your medication. Select your injection site. You want to go in with the needle and push down on this plunger. Push down until it stops, remove the needle, and make sure that that number reads 0. That ensures you got your full dose. When you're done with the injection, you will use your large needle cap to recap the needle, twist it off, and toss it into your sharps container. You'll need to use a new injection needle each night. One thing to note when dialing to your dose, if you accidentally go past your dose, don't dial back down. Instead, go all the way out until there are no numbers appearing, snap back in, and redial. In order to utilize all of the medication in your Follistim cartridge in hopes to save you some money, is to use the overfill amount of medication. In every cartridge, there's 100 units of overfill. In order to utilize that, you will dial up to your dose and administer the injection. When the plunger stops, you will need to take out the needle, look to see what number is left, write this number down. You will then need to take off that needle, take out the cartridge, and replace with a new cartridge and a new needle. Then dial to the dose that you wrote down. After the second injection, you'll then have remaining medication in your cartridge. You should recap your pen and place this back in the refrigerator for the next night. Now let's review the Lupron Trigger. Please note, you'll receive an email from your nurse on the night of trigger with the specific timing and dosage for the medication. Lupron comes in 2 forms, a Lupron 2-week kit or Leuprolide acetate, or a compounded trigger that should be in your refrigerator. You will have one or the other. The instructions for trigger are exactly the same. Both will be drawn to 80 units. You'll need to use an insulin syringe with the orange cap, remove the top cap and the bottom cap. You'll then go into your vial. You'll either need to remove the foil top or pop off the gray top. You'll then puncture into your vial, turn the vial upside down, and draw to the 80 units. Pull to the 80 units, remove the needle, and now you're ready to prepare for injection. Choose your injection site, go all the way in with the needle, push down on the plunger, and then dispose of the needle and syringe in the proper container. Now let's review the HCG trigger medication. This medication comes in multiple forms, Pregnyl or Novaril. Please note to look out for your nurse's email on the night of trigger regarding the exact timing and dosage of this medication. To prepare for this injection, you'll need your medication, which inside the box has a powder vial and a liquid vial. You'll need a 3 cc syringe, a mixing needle. That's a large needle, 18 gauge, 20 gauge, or 22 is fine, and a smaller injection needle, which is 27 gauge, 1/2 inch. To begin, you'll need to remove the caps from both vials. You'll then need to take your 3 cc syringe and the mixing needle. Attach the mixing needle to the syringe, twist until it's tight. You'll then need to dilute the medication. The amount of medication that you draw up from the liquid is dependent on the specific instructions you received from your nurse. You'll puncture into the liquid vial, turn the vial upside down. An important thing to remember, the top of the needle must be in liquid at all times in order to draw up the liquid. This means you'll need to pull down on the needle. You'll then draw up to the specified amount of liquid. remove from the vial, puncture into the powder vial, and push in all of the fluid. The powder will dissolve almost instantly, but just gently swirl to dissolve. Some doses will require going back into the liquid and drawing more fluid. You'll then go back into the powder and push all that fluid in. Once dissolved, turn it upside down, and again, ensure the needle is in the liquid. So pull down on your needle so that it's submerged in liquid and draw down to the 1. You'll then remove from the vial. You'll need to recap the large needle, twist off, and take your injection needle, twist on, remove the cap, and prepare for the injection. Once the injection is administered, you'll dispose of in the proper container. Now let's review your GnRH antagonists. They come in 2 forms, the Ganerelix and the Cetrotide. The Ganerelix is a pre-filled syringe. You therefore will need to just take off the cap, and the medication is ready to be administered. To remove the bubble, gently apply pressure until the medication fills to the top. You then will choose your injection site, go straight in, and push down on the plunger. The Cetrotide requires mixing. You'll first need to take the dilution and the powder, and it comes with 2 needles, one for mixing and one for injection. Remove the white cap and add on the mixing needle. This has a yellow label. The needle gets twisted onto the top, and you will then need to insert into the powder. Remove the blue cap of the powder by gently flicking. Place the powder on the table and go straight in with your mixing needle. Once the needle is in, you will push all of the fluid in and gently swirl the vial so that the powder dissolves. Once the medication is diluted, you'll need to turn upside down and pull down on the needle so that it's submerged in the liquid. You'll then need to drop all of the liquid. Once drawn up, you'll pull off the vial and you'll need to recap the mixing needle. Twist to remove the mixing needle. You'll then take your injection needle, twist onto the syringe, and remove the cap. If there's any air in the needle, be sure to face the needle towards the ceiling and gently apply pressure to the plunger until it's all medication. You'll then pick your injection site, go straight in with the needle, and push down on the plunger to administer. The last medication is Omnitrope. It is a growth hormone and is only prescribed to certain patients based on your protocol. This medication will also need to be mixed and can be kept at room temperature until mixed and then should be refrigerated. It will be taken in the evenings with your stimulation medications. Each vial of Omnitrope will last you 4 nights once mixed. In order to mix the medication, you'll need a 3 cc syringe and a large mixing needle. A 20 gauge, 18 gauge, or a 22 gauge was fine. First, you'll need to remove the tops from each vial. You'll then open your 3 cc syringe and the mixing needle. Twist the mixing needle onto the syringe until tight. You'll then remove the cap and first go into the liquid. Puncture in, turn upside down, make sure the top of the needle is submerged in liquid. So pull down on the needle and draw up all of the fluid. This typically brings you down to just below 1 cc. You'll then puncture into your powder vial and push in all of the diluent. Gently swirl to dissolve and remove the mixing needle. You'll then need an individually wrapped insulin syringe. Open the syringe. Remove the orange cap. Puncture into your diluted mixture and draw just to the 25. Once you've drawn to 25, pull the needle out of the vial and prepare for your injection. After the injection, you'll dispose of the needle in a sharps container. You'll then be able to use this diluted mixture again for the next 3 nights. You'll need to place this in the refrigerator. Each night, you'll draw to the 25 unit marker and inject. On the 5th night, you'll need to get a new set of powder and liquid vial and remix. All of the injections will be given in the stomach region. To select your site, you want to be a minimum of 2 finger widths away from the belly button, but more like 4 is most comfortable. You can select a site to the right, left, or below the belly button region. You want to avoid any scar tissues. Each night, you want to change your injection site. Since you're doing 2 injections, you can do 1 next to the other, or 1 on one side and 1 on the other, whichever your preference. A frequent concern when preparing for your injection is air bubbles in your syringe. It is always safe to inject an air bubble as we're only going into fatty tissues. However, if you notice that there's a large air bubble in your syringe, you just gently tap on the syringe until all the air collects at the top of the needle. You'll then push on the plunger until it fills with fluid. When ready to give your injection, you need to have a gauze, alcohol swab, and your medication ready. You'll then select your site, pinch the fat, and alcohol swab. After you administer your injection, you'll then dispose of the needle and syringe in the proper disposal container. This is all a generalized review of the medications. Everyone's treatment protocol is different and specified for you to make sure you have the best outcome. There are other protocols that were not covered in detail and may be a little bit different. Email is the primary form of communication between you and the nurse. That means that you should be regularly checking your emails prior to the start of your stimulation and throughout your cycle. Most emails will be sent to follow up after each monitoring appointment between 12 and 5 p.m. If you are expecting an email, please be sure to check your junk or spam folder.